Hello, everyone. So I am Jean-Joseph Christophe, the founder of CASIS company, a company specialized in cardiac imaging software and based in Dijon, in France. So we are a company spin-off of the Dijon University Hospital, and the project started like 25 years ago from a team of radiologists. Their project led to an article in the Nature Genetics journal in 2007. And to the creation of the company in 2016. And I have to add that the link with Japan are before the creation of the company, as I am myself graduated from the Tohoku Daigaku as for a PhD. So let's continue with a small video of introduction to our company. So for those of you who are not very familiar with cardiac diagnosis, in order for a physician to establish its diagnosis, he will need more often to start with the echo imaging. And then, if there is a suspicion, for instance, of heart failure, he will need to go further, for instance, with a cardiac MRI. The advantage of cardiac MRI is it will provide a deeper information. However, it's expensive, the examination is quite long, and it's quite complex. In particular, the most important parameter for the physician is called the fraction ejection fraction, which is the ratio of blood expelled by the heart. And to have this information, the physician will need contours drawn in hundreds of images. And doing it manually can take a lot of time from the physician. Hence, it is necessary to have suitable software. And this is exactly what we offer at CASIS. The software KIR, Quantified Imaging Resource, detects automatically contours of the heart in order to assess almost hundreds different clinical parameters to support the physician in establishing his cardiac diagnosis. KIR is a medical device in class 2A in the European classification. It's got a CE mark. And it's reduced the time for the physician to analyze the images. It is the first software in this category to be listed by the French recommend body UGAP. Let's go to a video that I'm going to comment about our software. So it includes all the necessary tools that the physician needs to establish the diagnosis. It's a multilingual software available in 6 languages, which includes Japanese. And for the most important part for the physician, which is called the cardiac function, we have a deep learning algorithm, which includes clinical criteria. Another features is the strain. which allow the physician to have information regarding the motion of the myocardium. We offer a very neat and simple report, and also a very easy to use interface. Late enhancements will help the physician to have an evaluation of the scarce area of the heart. The first pass, and also different features for the aorta, such as the compliance or the flow for the thoracic aorta, but also for the abdominal aorta. Lastly, CARE also offers features for T1, T2, and T2 star mapping. So, as you can see, CARE is a complete software which is compatible for Windows, Mac, but also Linux, for any PACS and for any MRI machine. So our core value at CASIS are to offer intuitive, visual, and flexible applications. We think that less time drawing contours will help the physician to have more time with their patients. We believe that we don't want to have AI for AI company, but we want to be a clinically dedicated company which use AI to help physicians. We are a global company, meaning that all software is available in 6 languages. And eventually, we are aiming at contributing in easing the care of the patients who contracted cardiovascular disease, which is still now the first cause of death globally. So to give one example, for the ejection fraction, as I mentioned, you need contours in hundreds of images. And with deep learning algorithm, the issue is you will have some errors such as holes, inconsistencies, non-detection, or double. And we had the idea to add clinical criteria in our several layers of neural networks. And this allows us to improve actually the detection of and robustness of the myocardium. For all that to make sense, we need to have a real market. And cardiovascular imaging software markets is increasing at a rate of more than 8% each year. And it's expected to reach $528 million by 2023. Also, there is actually a complex topic, few competitors. I need to mention as well the 4D flow MRI, which got the hype recently. And we will have an application ready this year. From a regulatory point of view, I mentioned the fact that we've got the CE mark. We are going to apply for the 510K in the following weeks. And the next step for us will be the PMDA. So we are hoping to get it within 2 years. For all that to work, we need to have a reliable team. And CASIS, it's more than 20 persons from 15 different countries and 4 different continents, speaking as much different languages. And the board is constituted with Thomas, who is, as the CTO, developed the first academic version of the software in 2006, way before the creation of the company. Also, Guillaume, with a US citizen and worked 10 years in cardiovascular research in Harvard. Alain, with the inventor of the project. And myself, I got 2 PhD. I mentioned one from Tohoku University and the other one from Pierre-Marie Curie University. We also rely on an international scientific committee with, of course, physicians from Dijon University Hospital, but also the famous Paris APHP Hospital, Belgian professor, Professor Christopher in India, Professor Yilmaz in Germany, but also Terashima Sensei from Civic in Tokyo, and Ota Sensei from Tohoku Daigaku Byorin. And lastly, Professor Flame from the Cleveland Clinic. We have good feedback from physicians such as Thibault Leclerc in Dijon. For clinical practice, software ergonomics is optimized by medical advices. Saving time is a priority for better work. For Sanchimi in Belgium, special customers' demands for specific evolution are also swiftly responded thanks to the flexibility of the backdoor development team. But also in Japan, Nakata-sensei from GK Daigaku, the use of CASIS software has dramatically reduced the time required for cardiac MRI analysis. CASIS in Japan, as I already mentioned, is a long story starting from the beginning of the company with a project on aortic aneurysm called OurRisk. And in 2017, the ASCII workshop, 2018, the ITM Congress, and other projects and mission with JETRO, BPI France, and Business France. Since last year, we have a distributor, which is Visit, Japanese professor in our committee, and a Japanese team with Yukiko Chong, who is perfectly fluent in Japanese, even though she's Chinese, and Urabe-san. We are involved in several projects, such as Pacific, a 5 years project on heart failure with preserved ejection fraction, led by Sanofi. Advanced projects aiming at developing AI algorithm to improve the care of patients with myocardial infarct. And CISASO, a 5 years project led by the Münster Clinic in Germany, and to address sudden cardiac death. We are open for collaboration in other topics. I mentioned the OurRisk project for risk of rupture of aorta following aortic aneurysm. But also we have MyoCovid, which is a project to follow up patients with COVID and to follow up their myocardium. ADO-CMRI to have a fully automated software, and other opportunities. I thank you very much for your attention.